Alright, so we're quickly trying to look at the next disease condition of the spinal cord. This is what is known as ankylosing spondylitis. Okay, so ankylosing spondylitis is usually abbreviated as what? AS. Usually abbreviated as AS. Okay, so it's like there's inflammation of joints, then the bones in the spinal cord are kind of like fusing up, right? So it's an inflammatory form of arthritis. So it primarily affects the spine and the sacroiliac joints. So this is lead to pain, stiffness, right? There's potential fusion of the vertebrae over time if you leave it there. So it's part of a group of disease called as what? Spondyloarthropathies. So those ones basically they affect the spinal cord and all of that. So key features for this is there's inflammation of spinal joints, especially the sacroiliac joint. Okay, you can also have the spinal cord by itself. There's progressive pain and stiffness. Why? Because the ligaments that were here to make things flexible, they are becoming inflamed, they are being replaced by bone. The pain usually worsens in the morning or after some period of inactivity. That's basically what you'll be asking the patient. Improves exercise, not rest. So causes of risk factors is autoimmune origin. So sometimes it's your immune system that is attacking healthy tissues. Is strongly associated with what? HLA-B27 gene. It's more common in men, typically starts before the age 40. So family history increase the risk. Symptoms is chronic lower back pain. Stiffness usually improves with movement. Fatigue, there's pain in hips, shoulders and heels. You can have some inflammation in the eye. Then spinal fusion and stooped posture. Okay, so diagnosis is just physical examination and symptom history. You are trying to ask the patient about the history. So x-rays or MRI just to dictate sacroiliitis or spinal changes. Blood test for inflammation markers, HLA-B27. So treatments is you can actually improve all those anti-inflammatory drugs, that are drugs to stop the inflammation. Biologics that will basically calm down your immune system. Physical therapy, exercise. Surgery is rare, okay, not needed always. Complications can lead to spinal fusion, that's a bamboo spine. Reduce lung capacity, right? Osteoporosis, cardiovascular issues, vision problems when uveitis is basically being inflamed.